Hello students, welcome to today's drug chemistry class. Today's drug chemistry, I'm going to explain you about the basics of the drug chemistry. What is a drug and how, what is a drug, the definition and the WHO definition and pharmacology, what is a pharmacophore and the terminology in the medicinal chemistry, how it is helpful for in the human body, this studying the drug chemistry, how it is helpful, we are going to see. Drug, it is a substance. Drug is a substance and it is intended, used orally, applied topically for the purpose of mitigation, treatment, prevention, cure, diagnosis of disease and the disorder. It also maintains a good quality of health. And that is called as a drug. So, a condition of a living being or a plant or a human body one of its parts that impairs normal functioning and typically manifested by distinguishing the signs and symptoms is a disease. And for this disease, the treatment, diagnosis, and for the treatment, we use the drug. So, drug is a substance which is intended to use orally, applied topically for the purpose of use of mitigation, treatment, prevention, cure, and diagnosis of disease. And even for the disorder and maintenance of the good quality of health is known as drug. Any substance in part to give a therapeutic activity is known as drug. It is important to prevent the disease, disorder. It gives a therapeutic activities. A drug is important to give pharmacological response, and it act as the target site of the infection, and it prevents the injury or disease or the disorder. The WHO definition is a substance used to intend to modify or exploring pharmacological the physiological system or pathogenic state of a for the benefit of the recipient. So, drug is a substance used or intended to modify, explore physiological system and pathogenic system for the benefit of the recipient. Drug is a substance for purpose of diagnosis, prevention, relief, cure of the disease. It is important pharmacological response. It acts as the target site of the infection, preventing the injury, disease, or disorder. Drug administered in various routes. It was administered or it can be administered in various routes of administration depending on the types. The compounding. It is defined as a synthesis preparation of a drug and dosage from the laboratory or pharmaceutical industry is known as compounding. So some of the terms which are useful for a drug we are discussing. Compounding, it is nothing but the synthesis preparation of a drug and dosage from in laboratory or pharmaceutical industry is known as compound. And what is dispensing? The distribution or dispensing the drug in the patient is known as dispensing. The distribution or the dispensing the drug in the patient is known as dispensing. So these are the processes that are associated with pharmacist. What is a dosage form? Dosage form are the means by which drug molecules are delivered to sites of action within the body. Dosage forms are the means by which drug molecules are delivered to sites of action within the body. So, drug is active pharmaceutical ingredient plus excipients. So, API, it is the active ingredient that shows therapeutic activity. Excipient, it is chemically inert substance added along with drug. So, drug is the active pharmaceutical ingredient. At API, active pharmaceutical ingredient, plus excipients. The API is the main one which shows the therapeutic activity. Whereas excipient, it is chemically inert that gives the bulk for the drug. So only the API part is helpful for the therapeutic activity, whereas the excipient part is chemically inert. It adds to the mass of the drug. So the optimum quantity of a drug can show therapeutic response, but excess more than optimum quantity shows toxicity. Only the required quantity can show the therapeutic response, but excess more than optimum will give the toxicity. What are the different physical forms for a drug? You can take in the solution form, syrups form, suspension form, drops, injection. So that is the liquid dosage. Generally, we see the liquid dosage, eye drops, ear drops, and for small children, we take in the form of suspension of the syrups. Generally, the cough syrups are given in the form of syrups. And the injections, whatever is given intravenously, that is injection. So, this injection has a direct effect. Depending on the disease condition, the dosage will be given, the form of the dosage will be given. So sometimes if that was a serious condition, the liquid dosage will go on in the form of injection. And coming to the solid dosage form, we have capsule, tablets, powder. Solid dosage form. And semi-solid dosage forms is nothing but ointments. Generally, daily life, you come across these ointments. Semi-solid forms, oily ones. The creams, pastes, gels, all these are the semi-solid dosage form for drug. Now, what is the pharmacokinetics? We'll see. The pharmacokinetic study. We have seen the definition and the forms of ingestion. So, the pharmacokinetics, it is derived from the word pharmakon, means drug, and kinesis is the movement. What is the pharmacokinetics? The movement of the drug is pharmacokinetics. It is the quantitative study of drug movement in, through, and out of body and their relationship with pharmacological, therapeutic, or toxicological response in man and animals. So it is a quantitative study of drug movement in and through and out the body, and what is the relationship with pharmacological, therapeutic, and toxicological response in the man and animals. And what is dose regime? The frequency of the administration of the drug in particular dose. Frequency of administration of how far for a particular dose. So it can be ADME. Dosage regime includes ADME. Absorption, distribution, metabolism, excretion of the drug. See, what is pharmacology? Pharmacology deals with the effect of drugs on living tissues or organs. That is pharmacology. Pharmacology includes pharmacy, chemotherapy, toxicology, and phycology, activity of the drug, the therapeutics, etc. So the pharmacology has different branches like pharmacy, chemotherapy. See how it is affecting a drug, how it's affecting on the living tissue and organs. Pharmacology, it includes the different branches like the pharmacy, chemotherapy, toxicology, phycology, therapeutics, and etc. So pharmacophore is functional group present in the group in the drug. And what is a pharmacophore? It's a functional group that is present in the drug. Right? This is responsible for medicinal activity of the drug. Removal of pharmacophore from the drug molecule lessens or completely destroys the medicinal activity of the drug. So the heart of the drug is pharmacophore. So the pharmacophore is the functional group present in the drug. As we have seen previously, AP. API, active ingredient, which shows a therapeutic activity. So here pharmacophore is also the functional, just like the API. The common pharmacophoric groups are R group, OH group, alcoholic group, OR group, alkoxy group, aldehyde group, ketone group, halogen group. These are the common pharmacophoric groups. Now, what is the pharmacodynamics? I'm explaining you the basics. Later on, we'll see what is pharmacokinetics. So before that, what is pharmacodynamics? Pharmacodynamics deals with interaction and response of living organisms to chemical stimuli. Yeah, chemical stimuli in the absence of a disease is pharmacodynamics. Pharmacodynamics deals with interaction and response of living organisms to chemical stimuli. Next, this pharmacodynamics indicate the possibility of using a therapeutic agent, that is drug, in the treatment of the disease for the human beings. So pharmacodynamic deals with the interaction and response of the living organism to chemical stimuli. So it indicates possibility of using particular therapeutic agent, that is drug, for treatment of disease in human beings. Now we'll see about the pharmacokinetics. Pharmacokinetics deals with the drug concentration in the blood and tissues at different times. Pharmacokinetics deals with drug concentration in the blood and tissues at different times. It involves absorption, distribution, metabolism, and excretion of drug. Now we'll see what is absorption. Absorption is the process of movement of a drug from its site of administration to systematic circulation. So absorption is a process of movement of a drug. Absorption is a process of movement of a drug from its site of administration to systematic circulation is absorption. Yeah, we generally the absorption, the movement of the drug, how it is there. A site of administration. What is site of administration? You generally take, as I've told you, injections, or tablets, syrups, ointments. The administration site can be from mouth, intravenous, from skin. Okay, so intravenous. So solutions can be injected and intravenously. Injections also can be injected intravenously or through the mouth. or from the skin also the absorption can take place. And that goes to the systematic circulation. Now we'll see distribution. Distribution is the disappearance of substance throughout the fluids and tissues of the body. The movement of drug between one compartment to the other, that is distribution. Thus, drug substance is getting dispersed. It is getting dispersed. The substance are getting dispersed. The drugs are getting dispersed throughout the fluids and tissues of the body. The movement of the drug between one compartment to the another. That is distribution. So, what is elimination? Here, the process that tends to remove the drug from the body and terminates its action. Here, it removes, it is a process where the drug is removed from the body and the action is terminated. And this is for particular time period, the drug will stay in the body. After performing its activity, it is getting eliminated, or else it may cause any toxicity. So through urine, through feces, it gets eliminated out. That is elimination. Now coming to the metabolism. Metabolism is the irreversible transformation of the parent compound into daughter metabolites. So what is a metabolite here? The word has come, metabolites. Now, metabolism, irreversible transformation. It cannot be reversed. Once it is getting transformed, again it cannot come back. So once if it is getting transformed, again that is reversible. A parent compound will break down into smaller compounds, that is daughter compounds. Again, that parent compound cannot be regenerated, retransformed. So that is irreversible transformation of the metabolism. So here you should know what is a metabolite. Substance which participates in cellular metabolic reactions is called metabolite. It is called as the metabolite. So a substance which participates in cellular metabolic reactions is called metabolite. Metabolites are small intermediate molecules or products which are converted, which are directly involved in the normal growth, development, and reproduction. Small intermediate molecules or products which are involved in normal growth, development, and reproduction. There are many metabolites like vitamins, hormones. See, these are coenzymes. All these are involved in the metabolism. These are involved in the normal growth, development, and reproduction. Now we'll say what is an excretion? The elimination of the substance from the body. Here the elimination, it tends to remove the drug from the body and the action is terminated. Yeah, that is also elimination, and excretion is completely coming out from the body. Now here you'll see metabolites here. We'll see the first process is drug administration. You take orally, intravenous, intraperitoneal, subcutaneous, as I've told you, through skin, yeah, through venous, intravenous, orally, through mouth, intramuscular, inhalation. All this comes under the drug administration. And now, after drug administration, we are having absorption and distribution. Membranes of oral cavity, gastrointestinal tract, peritoneum, skin, muscles, lungs. Here, the absorption distribution takes place. And after that, it enters into the plasma protein. Yeah, it binds to the plasma protein binding. Sometimes it goes to the neuron receptor, the target site, or else sometimes it goes in for the metabolism into the liver. Inactivation here. And here after through plasma protein binding takes place. goes to the neuron receptors through metabolites, or else sometimes it enters into the liver and through comes out by the metabolites. And through the blood plasma, sometimes here the binding takes place and inactive storage deposits of the bone and fat. And also there is a chart of way. So once after the absorption and distribution, a different ways are there for metabolism. After absorption and distribution through plasma binding proteins, it can go to the target site neuron receptors, or else it can move on to the liver. Here, inactivation takes place and through metabolites. Here, these metabolites, after breakdown in the liver, again, its metabolites move on. Yeah. And sometimes it goes to the inactive storage deposits, that is bone and fat. After this binding process, inactivation process will take place. First is the drug administration. The second one is absorption and distribution. The third one is binding process. It can be done through the neuron receptors. Plasma protein binding can take place, goes to the neuron receptors, and through blood plasma it can go to the bone and fat, where inactive storage deposits takes place. In this way also it gets binded, and come for the liver, where inactivation takes place. And here from liver, I just metabolite, it goes out here from liver, feces, urine, water vapor, sweat, in the form it goes out. So it goes to the intestine, kidneys, lungs, sweat glands, etc. So excretion takes place, the fifth process. After going from liver and this metabolites, they go. For the excretion process, it goes into the intestines, kidneys, lung, sweat glands, and etc. After that, the excretion of the products takes place. The metabolism took place in the liver, and then excretion is taking place in the form of feces. All these are converted. And the excreted products can be feces, urine, water vapor, sweat, saliva, and so on. Now we'll see the drug moving pattern in the body. Drug moving pattern in the body, as I've told you, it is having the pharmacokinetic phase. This complete one is the pharmacokinetic phase. First, absorption, it is done orally. There are different ways of absorption we have seen. Okay. So after this absorption, say gastric muscles, lungs, skin, membrane, oral, gastrointestinal. Say oral, intravenous, intraperitoneal, subcutaneous, intramuscular, all inhalation is taking place. Yeah, this is first after administration, this absorption ADME process takes place. Absorption. Then goes the D, distribution. So absorption and distribution, yeah, in the skin, muscles, lungs, peritoneum, gastrointestinal tract, membranes of the oral cavity, where this absorption and distribution takes place. After absorption and distribution, then comes the metabolism, which takes place in the liver and small intestine. After that, excretion takes place. Elimination, that is excretion, takes place. Now, what are the ideal characters for a drug? See, the disease condition, drug is a substance. It is intended to modify, explore the physiological system. Pathogenic condition, it has to modify the pathogenic state for the benefit of the recipient. It should be used for the purpose of diagnosis, prevention, relief, and cure. So it has to be toxic, non-toxic, sorry. It has to be non-toxic. It shouldn't be toxic. And once after going into the body, that shouldn't go for any other reaction. It should be non-reactive. And the third one is it should be physiochemically stable. If it is unstable, again, it cannot perform its task. For what purpose we are taking, that purpose cannot be fulfilled if it is unstable. So it should be physiochemically stable. It should be physiochemically stable. Now, metabolically also it should be stable. The structure shouldn't get disturbed. Metabolically also it should be stable. It should be chemically inert. It shouldn't react after going into the body. And it can free from microbial contamination. It can free from the microbial contamination. Whatever is there, it should be free. It shouldn't get affected. And it can give both rapid as well as sustained activity. It can be, it need not be rapid. It can be rapid as well as slow, but the sustained activity should be there. It should be easily available. The drug which is easily available can be easily purchased. If it is not easily available, there is no use of this synthesis of the drug. So for the patient, that should be available easy. And moreover, it should be inexpensive and economical. Yeah, it should be available even for, yeah, that should be at the disposable even for the poor and the middle class. If it is inexpensive and economical, then every person can buy a drug, whichever is required. So these are the ideal characters for a drug. So once if these conditions, these characteristics are satisfied, then only it comes into the market. And it should be, yeah, the activity should be perfect with no side effects. Now we'll see the drug release pattern. What is the dosage form? Aqueous solution. We take possible intervening steps between administration appearance of drug in the solution in the gastrointestinal fluids. Your type of the dosage form, aqueous solution you can take aqueous suspension or immediate release of the solid dosage forms. Aqueous solution is taken, gets precipitated, suspension of the fine particles of the drug in gastrointestinal fluids will take place. Once if you take the aqueous solution, the precipitation takes place, suspension of the fine particles of drug will take place in the gastrointestinal fluid. If you take aqueous suspension also the same takes place. The fine suspension, fine particles suspension of the drug in the gastrointestinal fluids. And if it is a solid dosage form, disintegration should take place. Aggregation, those granules, deaggregation should take place. And again, the fine particles of drug, well, you can see in the gastrointestinal fluid. And whatever is formed here, these granules or else the fine particles of the drug, they undergo dissolution. They undergo dissolution. So possible intervening steps are these. After administration, appearance of drug solution in the gastrointestinal fluid. Yeah, after all these steps, now the dissolution takes place. Sometimes the aqueous solution directly also can go. Dissolution takes place and the solution of drug you can see in the gastrointestinal fluids. Now the absorption takes place in blood. Absorption takes place and it is transported along with the blood glucose. And thereby we can see the drug. This is the moving pattern of the drug. How the drug is getting released in the blood. Now we'll see the drugs classification. Coming to the drugs classification, we are having depressions, stimulants, antacids, analgesics, antibacterial, antiviral, mind altering drugs, many types, anesthetics, antipyretics, anti inflammatory, anticoagulant, antihistamines, antibiotics, antiseptics, antifungal. We'll have a brief look onto these, all these drugs. Still, there are different types. Yeah, this is a brief classification for the drugs. What does these drugs depressants? They slow down or depress the function of the central nervous system. In the moderate doses, depressants can make you feel relaxed. In larger doses, depressants can cause unconsciousness. They reduce breathing and heart rate. So generally the drug, it is not advisable. Always you don't prefer. The drug gets addicted for, the body will get addicted if you use more drugs. And the self immunity will get reduced. So maximum you have to avoid the usage of the drugs. And a person's speech may feel slurred and their movement sluggish and uncoordinated. So usage of this depressions should be lowered because they slow down, they depress the function of the central nervous system. They keep working and they don't let the body to work. In the moderate doses, depressions can make feel relaxed. Larger doses, unconsciousness by reducing breath and heart rate. And a person's key, as I've told you, they get slurred and the movement is sluggish and uncoordinated. See, example for these depressions are alcohol, opioids, heroin, morphine, codeine, these drugs, morphine, codeine, methadone, buprenorphine, cannabis, marijuana, minor tranquilizers, diazepam, like Valium, oxazepam, Seripax, tranquilizers. Some of the solvents and inhalants such as vapors from petrol, glue, the chrome paint, lighter fluid, all these come under the depressions. The what are stimulants? They speed up, stimulate the central nervous system. They can make users feel more awake, alert, and confident. Stimulants increase heart rate, the body temperature, and the blood pressure. Other physical effects include the reduced appetite, dilated pupils, talkativeness, agitation, sleep disturbance. These are all the stimulants. So they stimulate the central nervous system artificially and they feel confident. When you use the stimulants, they feel alert, confident, awake. Increase the heart rate, body temperature, BP, blood pressure. Other physical effects include reduced appetite, dilated pupils, talkativeness, all these. If sleeping disturbance can be caused. Example we'll see. Yeah. Caffeine, nicotine, tobacco. So nicotine in the tobacco it is a stimulants. So the smoking persons generally they get addicted for this tobacco cigarettes. The smokers can see nicotine in the tobacco it is a stimulant. So caffeine is present in coffee, tea. Yeah, that is an addiction. The tea, taking the tea, coffee. So these are all the stimulants. The smokers use tobacco generally because it's a stimulant for them. They'll get relaxed. Ephedrine, it is used in medicines for bronchitis, hay fever, and asthma. Even this is a stimulant. Amphetamines and methaphenetamides, they speed, ice, and persuade. known as speed, ice, and crystal meth. A cocaine you take, cocaine also known as coke and snow, and slimming tablets, duramine, tenuate. All these are the stimulants. Now, what is an antacid? Coming to the antacids, depending upon the drug action, we are having the classification. You have the classification based on the chemical structure. Basing on the chemical structure, see, basing on the chemical names, basing on the it can be classified. Basing on the chemical structures, it can be classified. Depending on the functional groups, you get. And we are having chemotherapeutic drugs. All these, most of them include these are the chemotherapeutic drugs. Antacids reduce the acidity in the body. Gelusil, you can take example, whatever acidity is there, if you take pickles, any acidic substances, the acidity increases, the pH is getting reduced, ulcers and different conditions arise for you. So taking antacids reduce the acidity in the body. Now, what is an analgesic? Yeah, this is the analgesic is a psychotherapeutic drug. It controls the body pains. Example, aspirin, paracetamol. Now, coming to the next one, antiviral. Antiviral drug is a chemotherapeutic drug. Antiviral drug is a chemotherapeutic drug. Acyclovir is an example. It is a chemotherapeutic drug. Example, acyclovir. Yeah, how you can go in this pandemic situation, antiviral drug. This virus, coronavirus, we are generally taking the remedies for. So it is an antiviral drug. Mind altering drugs, they change the state of the mind. So depending on the conditions, this mind altering drugs we take. Now, what are anesthetics? Anesthetics induces unconsciousness. It is a psychotherapeutic drug. Anesthetic is a psychotherapeutic drug. So these anesthetics induces unconsciousness. Xylocaine is the example. During operations, you take central anesthetic and local anesthetics. So for pain relieving, without knowing the pain, the operations and whatever conditions, whatever is being done, for unconsciousness, we take this anesthetic. Xylocaine is the local anesthetic example. Now, what are antipyretics? Antipyretic is a psychotherapeutic drug. It controls body temperature. Example, you can take paracetamol. So paracetamol comes under analgesic as well as antipyretic. Now going for the anti-inflammatory drug. Anti-inflammatory drug is an inhibitor drug. Anti-inflammatory drug is the inhibitor drug. A drug which inhibits the activity of metabolite. So the inflammation can be reduced using the anti-inflammatory drug. Example, ibuprofen. If there is any pain in the hands or the legs or any part of the body, we take the anti-inflammatory drug, the pain. So inflammation can be reduced. That is example, ibuprofen. Coming to the anticoagulant. See this anticoagulant. Once if there is any bleeding, if there is any fusing of the blood, then anticoagulant can be taken. You have natural anticoagulants, heparin in our body. But still, sometimes, if there is heavy bleeding, then you need to take anticoagulant. Or this is useful for the controlling of the blood flow from the body. And what is antihistamine? Antihistamines, it is an anti-allergic drug. Antihistamines. So the body, the histamines are released and the allergic reactions are increased. Once if a foreign particle enters into the body, the histamine is released and you get itching, such type of allergic actions can be seen. For this type of functions in the body, we need to control. So for that, we take antihistamine drug. Phenyramine is the example. Relent is a relent. You have the cetirizine, antihistamine drug. Cetirizine. So once a cough, yeah, if any dust enters, like that. And so for such allergic reactions, we take antihistamine drug. And what is an antibiotic? Antibiotics is a chemotherapeutic drug. Example penicillin, streptomycin. This antibiotics chemotherapeutic drug, it is used in the treatment and cure of specific disease. Penicillin, streptomycin are some of the examples for antibiotics. So particular microbe has to get destroyed completely. You take antibiotic for few days, few course. You take in a the course is taken in such a way that the life cycle gets destroyed for that microbe. And the next one is antiseptics. Once, what are antiseptics? Once, uh, if anything happens that undergoes for further infection of the body, for that further the body gets infected. Once if you get any hurt, if there is any allergic reaction, or if there is any bacterial infection or any other, for that still in order to control that microbe, in order to control that infection, we take antiseptics. For example, if you get any hurt, that go for septic. Iron, if you iron rod, if any for accidents, generally we take antiseptics. If for the body damage, to reduce the body damage, we take the for that you take the antiseptics. And coming to the antifungal, this is a chemotherapeutic drug. It is used in the treatment and cure of specific disease, that is fungal disease, that is antifungal. Clotrimazole is an example for antifungal. Generally, the skin diseases you'll be getting, that's a fungal diseases. Antifungal drug we use. Clotrimazole is an example. Like that, still there is more classification of the drug. There are classification of drugs. So basically, chemotherapeutic drugs, psychotherapeutic drugs, pharmacodynamic drugs, inhibitor drugs. This is the classification. Under these four categories, you get all these categories. We can still see antibacterial drugs, anti-malarial drugs, anti-protozoal drugs, anti-leprosy drugs, anti-cancer drugs, antiviral drugs, hypnotics, tranquilizers, respiratory system, anti-cough, anti-asthmatics, anti-ulcer drugs, anti-acid. Anti-acid, I've told you, no? Pharmacodynamic drug, gastrointestinal system we use. Gelusil is the example, and ranitidine is also another example. And the next one, pharmacodynamic drugs, urinary system, also diuretics we use, vasodilators we use for the cardiovascular system, anti-diabetes, anti-goiter drugs. Yeah, this is the classification. So basically, we have only four types: chemotherapeutic, psychotherapeutic, pharmacodynamic, and inhibitor drugs. Under this category, we get further subclassification, which I have discussed now. I hope you have understood today's drug chemistry class. So, what I have discussed is about the drug chemistry, that the basics were discussed. What is a drug? What are the terms involved? What is the WHO definition of the drug? What is pharmacology? What is a pharmacophore? What is pharmacodynamics? What is a compounding? What is dispensing? The dosage form and the types of the physical forms for a drug. and what are the pharmacokinetics, what is a metabolite, and still the nomenclature it is not given, and the classification of drugs, and what is a pharmacokinetic phases, ADME, how a drug is getting distributed, and ADME, how it is taking place. We have seen through diagrammatic representation, and the drug movement, moving pattern in the body, and what are the ideal characters for a drug, and what is the release pattern of a drug. And finally, I have classified the drugs. So I hope, and the types of the drugs, and the classification for some of them have given you examples. I hope you have felt interesting and you have understood my class. Thank you for sparing your time. Thank you, one and all.